Thanks for watching AM Northwest. Along with self-exams, mammograms can be lifesavers, so Janice Bangs went to Vancouver to find out about the latest in mammogram technology.
Good morning. I'm at Vancouver Radiologists in Vancouver, right across from the Vancouver Mall, where I'm going to find out about 3D mammography from Dr. Erik Kilgore. Good morning, Dr. Kilgore.
Good morning.
So 3D mammography has been around a couple of years, and as a radiologist, you found that it is really quite effective.
It's really an amazing technology. What it does is it complements standard 2D mammography, the type of mammogram that most women have had for a long time, by creating a 3D image of the breast tissue, which allows us to see the inner parts of the breast tissue.
So what is it you can see more of with 3D mammography versus 2D?
In ladies with dense breasts particularly, the 2D mammograms are sometimes very difficult to read because you have so much superimposed tissue. This is a conventional 2D mammogram, a regular digital mammogram. You're unable to scroll through this or manipulate the images at all. When we go to 3D mammograms, we can page through the image like pages in a book and look at the different planes of the breast tissue so that we can see masses or cysts or calcifications that are at different levels within the breast tissue. You'll notice here a small nodule that comes in and out of focus, so this allows us to determine where in the breast this nodule is.
And so are you able to detect certain kinds of breast cancer more effectively? Studies
have shown that there is an increase in the detection of invasive breast cancers, particularly small ones. It also, one of the advantages of the 3D mammogram is that it cuts back on call rate.
Oh, that's nice. And what about a lot of women are reluctant because they've heard it's uncomfortable? Is 3D mammography exam more comfortable?
The 3D mammography, the lady shouldn't notice much of a difference in the way it's obtained. It takes about the same amount of time. There's a slight difference in the way that the X-ray arm now travels in an arc over the breast tissue. It makes multiple images, but the exam time is about the same. Here at Vancouver Radiologists, we use the mammo pad, which is a cushion between the breast and the detector so that the lady is not it's not as uncomfortable.
Shockingly cold.
It's not as shockingly cold, and it's less uncomfortable.
Yeah, so that's good. And they really don't take very long. My experience is once I'm in the exam room, it literally is a few minutes of time.
Yeah, usually a lady can be in and out in less than 15 minutes.
And early detection is still key.
Yes, it's very important that women find breast cancers early. The 3D mammograms really help in detecting early breast cancer, and that can be very significant in improving patient survival and patient outcome if there were to be a breast cancer.
And less treatment if it's caught early, less invasive treatment.
Right, less invasive treatment, less difficulty that the patient may have to go through.
And what are the guidelines now for mammography?
There are conflicting guidelines, but the American College of Radiology and the American Cancer Society both recommend annual screening mammograms starting at age 40, and that's what we recommend here at Vancouver Radiologists.
Okay, well, thank you so much for showing us the latest technology. And if you'd like to find out more about 3D mammography, call Vancouver Radiologists to find out more or to schedule your own mammography. Back to you.
Thanks, Janice.